Hi everyone, can you hear me? Hello. So we've got, if you haven't got a seat yet, there's a few more seats at the front. So do, don't be shy, move to the front and we'll get started about now really. Hello, my name's Dan. I'm one of the organisers of this fantastic day. I want to tell you a little bit about a speaker that we were expecting and hoping to hear from this morning, Andy McCabe. He's a trained social worker, a social care future convener, and he's an all-round great guy. He was going to tell everyone about his experience of living with spinal muscular atrophy, his challenges with personal health budgets, and how he's combined his love of gaming and his tech skills to enable him to play, to connect, and to do more of the things that he loves. But unfortunately, we had a human-centered design fail, and he's not been able to join us. So many of the sessions during the day today focus on user involvement in planning new services or service change. We challenged speakers to ensure that it was a key part of sessions. It's not lost on us that we spent so long building an agenda that emphasizes the importance of these principles and they didn't apply them well enough to event planning. The team have done a lot of reflecting over the past few days and wanted to share some of our thoughts and reflections about this with you. 1, involve people with lived experience as early as possible. From the beginning is best. Do this for service design, product design, event planning, everything. Always double check what wheelchair accessible actually means. Never assume that things will be all right for someone with care needs. We know that tech can offer convenience, but think about the experience that it provides. If it enhances users' experience, great. If it doesn't, the convenience shouldn't really matter. And lastly, front up when something goes wrong. The organisers of this event are pledging that any budget surplus from today will be used to support lived experience involvement from the very beginning of a future event, and not from the midpoint or towards the end. We're not sharing this to be self-congratulatory or on owning up to our faults. We're sharing it as wider learning and as a way to be transparent about what has happened. Although we could have done better and avoided this situation with Andy, now is a good time to thank Janice. Where's Janice? Is she here? Somewhere. Yep, at the back. Janice, who has provided feedback and constructive challenge on the agenda and aims of the day. And Roger and Mason, who some of you will hear from later on during the breakouts. So whilst it's not quite the inspiring message that you would have heard from Andy, we hope that it's at least a grounding one to get things started. And don't worry, there's plenty of inspiration coming up later on in the day. I'll now hand you over to Mike, our MC, who will formally introduce the day. We can't wait to get started.
Fantastic. So it's great to see so many people here today. This is our second digital summit. And last year I remember looking around and it was great to see many faces there that I recognised, but perhaps not as many faces as we would like to have seen. So it's great to see a full room today. And I think it plays to the message that digital is so important to the change that's taking place in the sector currently and across health and social care. It's a real period of learning and it's a real period of change and a real period of discomfort. And often during those periods, there's a great opportunity out of the chaos to bring order, to bring opportunity, and to make real change on the ground for the people who are at the heart of today, which is those people who use our services, who are residents or patients or carers, so that we can look at how digital is part of the solution, but not a replacement to human contact, which is at the heart of everything. housekeeping. So we're not expecting a fire drill, so if there is one, you'll see that the fire exits out of the building or behind you and behind myself, and you go out to the front of the building. The lavatories, if you haven't used them, are to your right. There's also cloakroom there if you want to lose your jacket at some point. So they're the basic housekeepings. So it's wonderful, as I say, to have all you wise and wonderful people in a room today. This is an opportunity for bold ideas, but also how do we practically implement it? How do we get practical insights? And as Dan was just talking about, learning the lessons of the journeys that we're all going on. We'd like to encourage you all to play an active role within the day. This isn't about us talking to you, it's about us collectively learning from one another, enjoying the day, getting some value, and changing people's lives. So the last thing I'd just like to say, and I don't really need to do it in any more detail because actually it's already been picked up on, and that's a big thank you to the likes of Janice, Roger and Mason who are here today and who are helping influence and shape the agenda for the future. So I hope you all have a wonderful afternoon and enjoy yourself, and we'll move over to the first panel of the day.
If I come down this end, and you line yourselves up there the other. Well, good morning, everyone. Am I mic'd up? Can you hear me okay? Brilliant. Lovely to see everybody. So many familiar faces from the last Digital Care Summit, and so many new ones in the room. My name's Matt Skinner. I'm the Chief Exec at Care City. We're an innovation agency working in North East London, supporting innovation across health and social care. And I'm really pleased this morning to be kicking off with, I think, quite a forward-looking panel and hopefully a discussion with some great panellists. And we're going to be inviting some contributions from the audience. And I'll give up the game already. We've got a couple of people planted in the audience to give some thought into this, hopefully, conversation debate as well. So lots to look forward to. So I guess across the country at the moment, we've got things like the NHS 10-year plan, the new Neighbourhood Health Model, really exciting. In the last week, there's 43 pioneer sites selected across the country to be the kind of vanguards, I guess, of what this new model across health and social care could look like. We've got the Casey Review, hopefully going to be setting out some really bold challenge and reform for us all to consider over the next few months. And at the same time, I guess, looking in the news every day, advances in digital, the future of AI going to drive us all out of work or maybe make work better, who knows? Giving us these tools that I guess only a few years ago we probably couldn't even have imagined. So I guess some of that is what we're going to talk about in this first panel this morning. And to get us started, I think we're probably going to get right into the big questions of the day. I think we've got this really incredible moment in front of us for change, and it would be really interesting to explore, I guess, as part of this discussion, like the real story, I think, which is, okay, well, what do we do with it? How do we make this change feel real in our neighbourhoods and in our communities, for our people and for our staff and our organisations? So this panel titled Seizing the Moment, Driving Imaginative Change in Health and Care is all about that. It's about why now is the time to be bold, to think differently, and act together. And I'm really pleased to be joined by a fantastic lineup. That's all of their names. But I'll introduce them. I'll let them all introduce themselves in just a second. Got Helen, who is the CEO of the Brandon Trust and Chair of Care City, next to me. Lisa Wilson and Sam Bassett from the Royal Borough of Greenwich, doing some amazing work. Looking forward to hearing all about that as part of this. And I've pulled Mike Armstrong in at the very last minute down the end there, who is the MD of Haven Care Homes and our MC for today. I'll try and join in the conversation as well. I'm going to ask first then that our panel kind of introduce themselves and give a couple of minutes, however long you'd like, just kind of reflecting on the topic, I guess, at hand. So Helen, I'll come to you first.
Great. Thanks, Matt. It's great to be here. And thank you for just participating in what I think will be a really rich discussion today, and hopefully will lead to our ability to be really effective change agents for health and care wherever we're based. So Brandon Trust is quite a large social care provider. We specialise in support for people with learning disability and autism. We're primarily based in the southwest region, but has also got some provision in South London. And I think that I've worked in health and social care all my career. That's more than 30 years now. I've done a lot of that in the NHS, but more latterly I'm working in social care. And I think in terms of seizing the moment, I don't think there's ever been a more important time for us to think about how we better both align and integrate health and social care. Even though we talk, don't we, about the health and social care system, in actual fact, I think our lived experience is often that they're quite separate things. They exist in the same place, and they serve the same people and citizens, but they're not always as joined up or as integrated as we're like. And I think that we're really starting to think much more about outcomes. How do we get the best outcomes for individuals, for communities, for whole populations? And I think we're only going to get the best outcomes for people if we take that sort of integration challenge much more seriously. I've been involved for years, or in fact decades now, around this whole agenda of improvement, change, transformation. And I think we've tried to make things better by doing a bit more of the same, but trying harder, doing the same things better. And I think seizing the moment for me means taking this moment of change where we've got all of those opportunities you articulated, Matt. We've got the Casey Commission, we've got the 10-year plan, we've got local government reform. I think now is our opportunity to do things very differently and make some more seismic shifts in the way that we think and the way that we work.
Fantastic. Thank you, Helen. We'll come back to those seismic shifts in the conversation, I think. Lisa.
Thank you. And following that, Helen, as always, when we come together, as we have done before, means connection for me. So I'm Lisa. I lead health and care commissioning in the Royal Borough of Greenwich. That is a massive privilege for me because I didn't always work in such a place-based system. I worked in county councils before and other systems which were so huge. Actually, human relationships are quite difficult to maintain in those systems in the way that we need to now. That opportunity 3.5 years ago means that now I feel like we're making a big impact, and this shift for me, if I go back 20 plus years when I was working in public health but actually disguised as somebody in the voluntary sector, is really important to the context we're in today. So I studied health and social care policy. I sat in a campus with an asylum around me. That's where we were hosted. And that made me think really deeply about where people were in our human-centred systems and how they design them and should design them with us. We've got the privilege in Greenwich that we do that with our people as much as we can, and the digital health care service is no different to that. In fact, a really good example of that. That policy shift for me is the seismic change that you think about and you've spoken about, Helen, because I think we're in a time now, and it doesn't escape me also that we're in autumn. That's a seismic shift seasonally as well. We're shedding the old and into the new, and you think about the milestones we're working to for the spring and the summer next year. We have to do some of this concurrently. We're going into the winter, pressures in the system. We often process drive those pressures into being outcomes that are better for people. To a certain extent that works, and we often do that separately as organisations rather than together. This, for me, is very different. How do we think about the broken system that we've got today, keep it safely running whilst we break it? That takes bravery and humility, and we have to be humans and drive the change through human system change, not process change. We have different cultures, therefore, that are coming together when we're thinking about NHS, social care, voluntary sector, different mindsets. How do we get the magic of those ingredients coming together in this seismic shift so we don't crowd out the ideas from our communities, our faith-led groups, our community leaders, complement those by our professional knowledge and wisdom. And then the real thing for me is that we're spending money in the system on people, workforce coming together. What do those workers do now and what do they need to do tomorrow? and how do we intentionally design that for those 3 shifts, and enabled by digital within it. So that's the other opportunity for me. If I say to my family, you know, what is it that makes a difference for you in 10 years' time? My dad's expectations of living a life are very different to my nan's. Mine are very different. I'll probably want to disappear somewhere in a field and be camping and have a fire, not be in a care home. How do we think about what our humans want today and design that into the future in a really human way? Because this is the time not for process, this is the time for putting our energy into better human-centred systems. And if we can go away with that thought today about the how, if we know the why and we think about the how and we put our energy together, we are then going to integrate the system, not integrate the NHS with itself. A health service, it's a health and care service for me, and a well-being service for the future, so people get the social care model of health or the social model of health complemented by all that magic coming together. So that's the moment for me. Let's think about how we do it together and see power, not try and hoard power, because that will be the danger and the watch out for me in this time when we're all trying to struggle with saving money as well.
Thank you, Lisa. I was struggling to write down as many of those sentences as possible. I'm going to bring you back on later, I think.
I will, but I mean, it was important for me in the outcomes at the beginning to just ground us in some of that, because if we go forward in the conversation, for me, tripping over some of those important points, it'd be quite difficult.
Brilliant, thank you. Sam?
Morning everybody, so I'm Sam, I'm the Head of Digital Health and Care at Greenwich, so I have also the privilege of leading a technology service which is across health and care, which is amazing, doing a lot of really great work. I think the key takeaway for me today is, as Lisa's reflected, about people. So the thing from my background, which is practice, is always about how to give individual people the best quality of life, how do we empower them? And so often that is in the work we're doing about our relationships with others. So how do we encourage people to think differently? How do we collaborate as structures around people? And then how do we build for people based on what they want? So how do we enable people to have an empowered individual life about all the things that they care about and how they receive support when they need it, without us putting in binary structures as we have done in the past? So how do we be more collaborative and how do we be more thoughtful in how we design? So that will be some of the themes that I'd like to cover today.
Thank you, Sam. And Mike?
Excellent, thank you. So I'm a social care provider. I've been doing it about 15 years. I've always been interested in people. I was involved in politics before that. So I've always been interested in social policy, particularly around health, education, and those types of issues. And that's what drew me into social care. So originally I was in a residential setting. I moved from residential into nursing, which was a vastly different world, but really interesting. And you had to think much wider about how you can enable people to live fulfilled lives, I found, from what I was used to. And it was a really good learning experience, and I guess sparked my curiosity around technology. So I was doing digital care planning. I think I took person-centred software on in about 14 years ago, so I was like one of their first clients, which was quite interesting because they're quite a different company now. Running alongside that, I had my father in my ear. So my father had his own computer company, was interested in technology. Does anybody remember the VIC-20? Yeah, so whilst my mates all had a Commodore 64, which was the coolest bit of kit out at the time, I had to have a VIC-20 because you could program it. So that was my life. So you've got this desire for understanding social policy. My father was a councillor originally of a different party to me, so there was sparks about what the solutions are. And then there was this grounding in technology about being a part of the solutions. And I guess really I'm just living out my childhood on a day-to-day basis with people's lives of an age group that I recognise because my grandparents, when they retired, moved to our home. And so I spent my life with people who fought in the war and stuff. So I guess that's really my driver, and that's what sort of brings it all together as I guess that human story that we were talking about earlier.
Brilliant. I mean, well, thank you all. I think there's so many different directions that we could probably go in terms of the conversation. And also super aware that I shared some of the questions I might ask with some of the panel and not with others. So sorry about that, Mike. But I might start with one that is not asked of any of you or that I prepped you for, because I think one of the things that you started to get me thinking about, Lisa in particular, was around the kind of mindset shift and the behaviours that are going to be needed if the kind of change that we want to imagine is to be made real, let alone the use of kind of digital and technology, which I know Sam very closely, particularly in Greenwich and Mike in your care homes as well. They're very kitted out, Mike's care homes, with all sorts of amazing technology. But yeah, maybe Lisa, if I come to you just about that kind of behaviour and mindset piece that feels massively key to unlocking some of the kind of ways of working and the partnerships that you were talking about. Reflections on that.
It's massively important. So one of the things that drew me to Greenwich was actually the strength of the foundations of the partnership, actually that true magic of people coming together and the fact that there were those foundations there. So if you lift off from that where we are today, we're a cooperative borough, so that means that we're thinking about our mission and how we're supporting people to deliver those outcomes right on the ground, and we're doing that as a partnership. But then the value base and the behaviours, they all equal culture. And for me, if we don't pay attention to that, we lose the foundations that we've all invested in. And actually in these times of change at the moment, I'm really sad to hear my colleagues across other areas of London and the country where the ICB changes mean that some of that kind of investment locally is being sucked up into regions rather than down into place. I'm thankful in South East London that we're not really in that space, I don't think, and we're going to hope for a future that's a bit different where we retain some of that. We're working in such difficult times now that if you don't think about the closest you can get to place and people in that place being driven through those relationships, we're going to really miss something. So if we start with what is our alignment as humans, we spoke at Social Care Futures, didn't we, Helen? We talked about something in a really tricky workshop, but we found an energy connection that we could align on and we could collaborate on. If you think about that right from the person that's coming into their home or supporting them out in the community or in an acute setting or somewhere else, and think about that in our responsibility as leaders in a system, that's quite powerful. Because every step we take, every moment we harness in a day, and the thing that we're doing in that one day breeds that culture. And that then is towards the future. I take that really seriously as a leader because I'm here to make a difference. That's what I get up in the morning to do. The fire in my belly is not just for my own intent and purpose. I'm doing it with good intent for people. And I ground myself in that every morning, and that goes into hopefully the relationships. When they get tricky, which they will, and they are, if you've got those relationships, you can have hard conversations, you can build bridges from that, and you can get to that future. If you unfortunately disentangle those relationships, I think that's the watch out for me now. Because whose money is it to save in that system? It's the £1 that comes into that system that comes down from government or from local assets. That £1, what impact can we have with that collectively?
Thanks, Lisa. I mean, for me, the sort of relationships bit at the moment feels so important across the system. But I think, I don't know, one of the things I've been reflecting on a lot is the kind of disinvestment in lots of ways in partnership working, which to your point about like, let's not have health integrate itself. Like, I think there's a huge thing there in terms of those relationships, a system in place. The imagination, the boldness needs to be shared across those organisations and relationships. So thank you. Helen, do you want to come in on that at all?
Well, I think when you've been around for years and indeed decades, I think what we'll recognise is, I think between us, we could probably recite every single big plan that has been published in the last at least 4 decades, I reckon, in this room. And most of those plans have somewhere at the centre a framing of change around structural change. So let's just take the Lansley White Paper just as a sort of historic example of what I'm talking about, which brought, again, very, very significant structural change. And I think there's a sort of premise, isn't there, that if we can get that structural change right, then other things will follow. And I think in my experience, it's just very, very rarely the case. I think we have to accept that the structural change is something that we have to manage. You know, there will be a new architecture, there will be the differently focused ICBs, which will be smaller. You know, there will be these hospital groups emerging. I think there will be some structural change in social care. Those structural phenomena, I think, will be with us as we sort of approach the next 3, 4, 5, 10 years. But I think we've just got to get super clear on what are the real levers for change. Those change structures will not deliver us the outcomes and the benefits that we want for people and place. So what are the other levers that we really need to be paying attention to and investing in? And I think one of those first levers is relationships. I think it's remembering that we're all on the same side, and that side is making sure that we get the right outcomes for as many people for as much of the time as we possibly can. And I think sometimes the design of the structure almost like pits us against one another. You know, do the acute trusts get more of their fair share of resource than the mental health trusts or primary care? You know, I mean, look at social care and health. You know, you look at things like, you know, the fair pay agreement for social care. So you look at the terms and conditions of workers in the NHS versus social care. The system can sort of pit us against one another as if we're competing with one another for resource or for advantage. I think if we can just remember we're all on the same side, we have got the same why. And therefore we've got to invest in relationships, in collaboration, in finding and identifying solutions together, and particularly solutions that we can deliver together for the greater good.
Here, and let's face it, I think in those collaborative models is probably where we're going to have the most creative, aspirational, bold kind of ideas for change as well. So yeah, massively. Sam, I might come to you and talk a little bit more about the role digital might play in some of this, and given, I guess, the title of our summit today, and some of the great stuff that's been happening in your bit of the world over in Greenwich. Like, what's some of your aspirations for this? And I guess that behavioural change bit as well, which feels massively connected.
So I think digital technology, connectivity are great enablers for us, because it enables us to consider how we might manage old problems in new ways. And I think the point that you made, Helen, is really succinct, in that we should be considering how we maybe fundamentally or reformationally reconsider the delivery around a person. So instead of focusing on structures, which we do all too often, and how we might reorganise structures, we should be working together in a collaborative way with people, so in a co-design process or a co-production process, to think what is the outcome that we want to achieve, and what is the end goal that we want to get to, and how do we format ourselves in the middle. And often we're finding that connectivity and digital and technology are significant ways for us to think about doing that differently. And so I think there's a mind shift. We'll bleep that one out on the live recording. There's a mind shift change for us all to consider around these new opportunities that we have, and how we think about it in a collaborative way. So how we work more openly, to your point, Lisa, how we build good relationships, which so much of this is fundamentally built on. And we should be absolutely leveraging the opportunities that we all take for granted every day, using technology in our everyday lives, and how they might support people to have a much better quality of life. But it shouldn't always be the answer. I think that's really key. A key point for us to consider today. It's not the panacea for everything, but it's a very great enabler and leveller.
Great, thanks. Mike, can I come down your end of the row, so to speak? I mean, I've been to lots of your care homes. You're using lots of really amazing technology, but it always feels like it comes from a very human-centred place. Like, you're very conscious about how families feel about that technology as much as the person in benefit of it as well. Like, your workforce feel very motivated to try these new approaches. Your reflections on, I guess, this moment of change, like relationships with the local authorities and other providers in this space as well?
Yeah, so I think for our workforce, one of the reasons they're quite open to trying the technology is actually because we accept there's a level of risk that goes with these ideas. So we don't go, we are implementing something that's got to succeed. It's like, one, how does it impact on your time to to build relationships. Going back to your point, you talk about relationships within the system, which are massively important. That trust is massively important. But actually, it's about relationships, for me, between my workforce and our residents and their families. One of the things we talk about is how do you help people to help families to flourish during those last weeks, months, years of their life. And so we use technology really to answer those questions. And if it's not, or it's not helping us to use our internal resources differently, i.e. staff, so just a really simple example would be Flourish, where we use the remote monitoring. It's enabled us to use not just our nurses to collect information, but actually and data. It's actually enabled other parts of their workforce so that they're able to develop their skills and knowledge. So we think that's sort of a really important part of it. But also opening our doors, so bringing parts of the system in, because there's a lot of fault. You know, I go to a lot of NHS meetings. I'm very blessed that I get to work with NHS England. I'm one of the frailty leads on the ICB. So I get to see some of the conversations, and often when you've got health talking to health, you see part of the problem. Hopefully one of the things I bring is a bit of challenge around perhaps what a social care perspective is on that challenge. And so we'd like to open our door up so that yourselves and others can come in and see it working on the ground, see what actually works and what doesn't. And I think that's massively important. So not to be afraid.
Well, thank you. I'm going to change the focus maybe a little bit of the conversation. I think a lot of people sat in the audience will be trying to battle with this change, be it within their organisation or their own system, and hear that there's no more money available, and but we've got to change the way that we deliver our practice and fundamentally rethink that human experience for people. I guess what's the risk of not changing at the moment? I guess given that, and if we do have to deal with this change, like how do we tackle some of those complexities around there not being enough money, or how do we use those relationships that we have to work differently together, do you think? I look at Lisa because she looks like she has all the answers as she smiles at me.
I don't, and that was the point I was going to start with, really. I think we have to also be going towards this with a bit of humility. So one of the things that we've done is think about what do we know and what do we not know. So if you think about impact and building partnerships for impact, we're really good at doing pilots in health and social care and just hoping for the best. How many times have you done a pilot that's been really well evaluated, you know the impact that you were intending to have, and then you've measured that and you've had that impact? We've tried to think differently about that, and we've said, actually, what's the intended vision we've got, the mission we're on and the vision to get there, and how do we then assume what the impact that could be, try and work with some metrics and then understand what the human impacts are, the system impacts, the relational impacts, the organisational, all of those things, the money impacts, because actually we've got to tell a story of truth to power in this work, that actually there's a different path forward. But you're often asked to prove that thing so that people can take risk-based decisions. So in our local system, we did an impact model with our partners. So we partnered with Rethink, and we're now partnering with an organisation to deliver the technology after a procurement process. But we've gone towards a strategic adaptive partnership, because what we want is to understand the impact that we were intending to have, do some great stuff, and then understand whether that mattered to people and the workforce, and then pivot and adapt if we're not doing the right stuff. Whilst holding that shield around the work to say, trust us, we knew what we were doing and we thought we were on that right path. These investments, these ways of working in the system, we just need to adapt. And if that's an underpinning model of technology and digital for change, let's be really honest then about where we put the money in the system. So if that impact is showing that actually we could put more money over here because actually that's going to do better than putting it in the acute, let's do it. The risk for me of not doing that is that when you get into that tricky situation in a few months' time where we're asked to actually prove what we've done, how are we going to know which levers mattered most to people and who is going to take the risk-based approach? It's got to be the leaders in the system. You can get the policy coming down, it doesn't tell you the how. You have to tailor and adapt and craft that how at local places. And your story in your places is going to be very different to mine in Greenwich and very different from a kind of human-centred perspective. But if we all measure impact intentionally, what is the beauty of that going to be? You know, those trailblazing 42 odd places, we're going to learn from them. We're not one of them in Greenwich because we're carving a different path at the moment. We're still going to share our learning. So how do we go forward with, what's the impact I intend? How do I count it? And that mitigates the risks, because then you've got a bit of the evidence rather than 10 million pilots. Invest yourself and your things and your energy in the things that are going to make the difference. And you might need to stop doing some things. So the risk for me is if we don't stop doing some things, we will not put our energy into creating the magic that will make the future happen.
Yeah, here again, I think. On this, we could talk all day on this panel, I think, about some of these issues. Helen, you're itching to come in.
Can I follow up? So I can see Dan standing at the back, and I'm just going to applaud Dan for his opening. I thought, who's been to a conference that was opened in the way that Dan opened today, with some genuine learning and reflection, and with, like, one of the first things we've learned is put co-production right at the very beginning of any change process. So I think the biggest risk in terms of the sustainability of health and social care will be if we fail to put co-production with people, citizens and communities right at the front of that change process. Because if we think about the concept of value, who determines what adds value? Who determines what adds value to my health and well-being, or yours, or people with learning disabilities who live in Bristol, or people living with cancer in Greenwich, or people living with long-term conditions in Barking and Dagenham? Who determines what constitutes value? And I think that's where we've got to start co-producing with people, because at the moment, we all know, we've all got a different story to tell about how financial resource and people's time is wasted on things that don't add value. So we've got to move away from that, and I would suggest we do it by taking that very personalised approach, what matters to me, and that co-productive approach. And I think there's lots of things we could stop doing in both health and social care if only we were brave enough to do it. So I think Lisa's already encouraged us to think in a very bold way about change. And I think, therefore, we could really think, I think some of the things that will come through the discussions today, again about levers, what does it mean in terms of care planning? What does it mean in terms of data? What does it mean in terms of the decision making and the judgment we use once we start sharing data in a much more dynamic way? Because I think that could lead to very different care plans, very different, I think, judgments about risk and positive risk taking as well as risk management, and I think that could lead to very different outcomes for people and citizens.
Brilliant, thank you. Sam, before I open up maybe some questions to the audience or reflections, any thoughts on the kind of risk of not doing this change from your perspective?
Go on. I'll come in really quickly. I think Lisa touched on this a little bit. The risk is that we're going to have to start to make really difficult decisions about who we support and how, and that's going to, it's not going to be easy for those people, and we're not going to start to achieve the outcomes that you've described, Helen. For individuals, we're not going to get that value. So we have to take a longitudinal view, be brave, hold the course, and be really adaptable. So if I reflect on my service, everything that we do is designed around a person, and we are very flexible in how we do it. We have a long-term vision. We expect that that service is going to be generating impact, and we forecast that over a 10-year period. So this is a long-term enabler for the system. If we jump from pillar to post, doing pilots, standing up programs and projects, dropping them off quickly if we just think that there's no value or limited value and not take the learnings, then we're just going to build ourselves into cul-de-sacs, and we're going up wasting money, giving people poor outcomes, and to not be brave or have that long-term view.
I guess just an observation I'd make, and that is, there is no more money coming down the line. We've got to be really honest with ourselves, and it's not helped that I would argue that it's slightly strategically illiterate to be saying that we're going to focus on waiting lists when your 10-year plan says we're going to move from hospital to community, because the two things aren't aligned, and actually you've got to shift the money to where you want to make the change. But that's not going to happen. So I think we have to sit there and say, well, if they're not going to make it happen, how do we make it happen? Because we've got a responsibility for the people we care for. And there's a great opportunity for us now to step back, to, rationalise our approach, take more risk. I mean, one of the beauties of COVID, I shouldn't probably use the word beauty, but one of the beauties of COVID was it knocked down all of those walls between health, social care, local authorities, public health, and we all came together with a shared view, a shared desire. We've shown we can do it. We just need to, I would argue, refocus on how our relationships were during that period, because that's where the opportunity lies, in my opinion.
Can I just quickly come back on that, Mike? I absolutely agree. I think in a lot of ways, COVID was a significant enabler for a lot of the work that we're describing. And I think one of the key things that changed was people's attitudes to risk, which you described earlier as well. So digital and technology give us a much better way to consider risk or to meet risk. And in COVID, we did it really quickly. We justified what we had to do based on what was a very significant risk to the population. And now we've started to fall back into the habit of putting up those structures and barriers again, and to be far too discerning around risk. If we take a much more positive approach to that, then we can get a lot more done quicker, and ultimately I think we'll find that it's better for people, and that we tie ourselves in not worrying about things which actually most people don't care about.
Yeah,
brilliant,
really
thank
good
you.
point.
I just want to swing around to the room, I guess. I think we've got a roving mic somewhere. Yep, Mikey and Hannah. Anyone want to ask a question of our audience? Yeah, hand straight up down the front over here. So Hannah making her way.
Hi, so my name's Julia Tabra. I'm a physiotherapist by background, and I'm the Chief AHP at George's and Epsom St Helier Hospital in southwest London. Sorry, longest job title ever. I'm absolutely loving this. So good. Totally agree with everything that's already been said. One of the things that we've alluded to is that change is really scary and difficult. And we are preaching to the converted in this room, obviously, because we're the people who like change, otherwise we wouldn't be here. You alluded, Helen, to the group model, and I come from a hospital group. We employ 17,000 people, and there's huge benefits to that because we have acute and community providers coming together with good partnership working in some of our boroughs. But it is harder to mobilise change at scale, and the siloism that's creeped back in after COVID, which I would argue is now even stronger than it was before COVID, and the fact that the finances are so tricky, command and control is rearing its ugly head again. So how do we actually support our workforce through change whilst also working with people with lived experience? And I was just reading something recently in the HSJ about how education, networking, relationship building are all absolutely key, but that you also need to make the path that you're trying to create the one of least resistance and the easiest thing to do. So what things, this is such a hard question, by the way, you might not have the answer. How can we take the barriers out to make integrated care the easiest way forward so that people actually embrace it and do it in reality? Sorry.
I don't envy our panelists, but thank you.
Shall I give
Helen,
that?
Yes,
go for it.
please.
I started my career as a therapist working for St Helier NHS Trust. So there we go, we have something in common. If we take the scenario that you've described, which is you've got multiple professionals working in multiple teams across multiple sites and now even across multiple organisations in a whole group. And what you're saying is you want to really empower people to be part of a change process where they are able to use their skill, their experience, their wisdom, their autonomy to do the right thing, whilst recognising you've got this very top-down command and control. What is the key enabler? So people that have worked with me in this room will know that I'm really, really keen on this concept of the golden thread. What is it that connects, or if we think of even one of those people or one of those teams, they're agents in a system, aren't they? And what we want is connection between those agents. So I think Lisa started one of her contributions earlier, thinking about that concept of how do you really make sure that not only the relationships are nurtured, but that we've got a common why. What is it that is going to connect the motivation, the reason all of those people are getting out of bed and coming into work every day, the reason that people have chosen those roles in those teams in that part of London? How can we make sure that there's a really clear golden thread? And I think one of the things that we undercook in many change processes is communication. How do we get a really dynamic approach to communication so people really do understand the connection between the work that I'm doing and that shared why and that North Star, not just for my team or my service or my organisation, but actually for this place, for the people that we're serving together across this group. So I think the why, the relationships and the communication would be where I'd start. I hope that's helpful.
Sure. I think all of you are coming in, I think. Who wants to go first? Sam?
Well, I think actually, Helen, you stole most of what I was going to say, so thanks for that. I'd written some furious notes down, but I absolutely agree. So there's this overarching kind of thematic piece around what we want to achieve, which has to be really clearly communicated. So that'll be your strategic drivers, your vision. And then there's what that means to each individual person on the ground. So if we're not talking about people who might be accessing our support, we're talking about like operational teams, like individuals, and the context of how that lands is very different. And there's also some significant like hierarchical boundaries that sit between those messages. So you have team managers, you'll have senior leaders, you'll have supervisors, whatever that might be. So it's how do you get that consistent thread through from the top to the bottom, but put it in context. And that takes a lot of work, and I think that's the thing which we often overlook. So when we talk about change programs, particularly when we think about the adoption of digital or technology, what we often fundamentally miss is the people part. So how do we provide culture change support? So for example, if we reflect on the work that we've done in Greenwich, particularly around my service, we've got a significant culture change support angle, which is partly delivered operationally, partly delivered from some specialist support from Rethink partners, who I'm sure you'll hear from later. And there are many organisations like yours, Matt, that do similar. So to be responsible for the communication and messaging, training, professional development, and the dissemination of that into your kind of long-term BAU. So you don't always want to harbour that in a specific function. You want to disseminate it as part of your core practice. But it takes upfront effort. You can't just go and buy a new system or buy a load of tech and just hope that people are going to use it in context of how they deliver specifically and day to day, even if you've all got the same shared goal. So I think we need to see more of that kind of protected support around culture and engagement, and it needs to be very well built into any change programme.
So I think if you look at big business and small business, why does a small business grow into a big business? Well, at the beginning, they're really close to the people that they're there to serve or sell to. It's that relationship with their customer or the user. And what happens, in my view, when you get bigger and to a certain size, that relationship becomes strained and you become more remote to it. And I sort of feel, dare I say it, that the NHS largely feels that the public now is there to serve them rather than they are there to serve. Because when I sit in meetings, often what the conversation's about is bed blocking or the, how do we ensure that people move through the system quicker? How do we stop them going into hospital quicker? What we very rarely have a conversation about, which is where I think we need to move to start that change, is start with the individual, start with their lives, and how is it we build something that works for them? And how does technology play an important role within that? I mean, things like Amazon Echoes, isn't it? I'm sure there's others you can purchase, Google, whatever they call themselves. Something as simple as that is a real assistance in our own lives. You know, it's really basic technology that, you know, people are using all the time. So technology can play a really important role with that, but ultimately, I just think we need to come back to those who are having to use our services first and put them at the heart of everything, and allow them to help us build it out. I think Dan's point right at the beginning, today's a great lesson in that, and one we should hold on to.
Thanks, Mike. Lisa?
Brilliant question, and one that we're tackling at the moment really thoughtfully, because if you think about the threats in the system at the moment and the behaviours that they then employ, so people in the workforce are quite threatened at the moment because of all the context we're in. Shortage of money means shortage of jobs, means careers going, family relationships impacted, people's homes and lives impacted. If you then go into those conversations with that workforce and say, we're going to change you and we're going to do it from the top down, what you might get is an emotional, traumatic response to change rather than an excited response to change. And I think that's all over the place at the moment. So I'm trying to think about how do we get into the conversations with our workforce, and not through this top-down hierarchy messaging, but really system change happens across. So my best relationships are where I'm sat side by side with somebody sharing, not when somebody's going, you shall do this. And actually what you find when you're in those human-centred conversations with your workforce will often be, the ideas will come from them because they won't feel threatened, and you're in that conversation about, actually what's the stuff you do in your day that adds no value, to your point, Helen, to the people you're working with? What could be different about that to enable the value of the things you do in your day-to-day, or could do in the future in a different role, that add value for you and that person when you're sat side by side? And I have always found some of the most inspirational leaders within the workforce doing the work. Leadership is not about hierarchy. So if you think about the bright spots in your teams where people are really energised by making a difference, you'll find some unsuspecting people there that have the ideas you need, and they will be the change agents. So you don't have to rely on this hard up and down power anymore. You can think about how do you harness the power within your workforce for the ideas, because they're there. And as leaders, I think our role is to bring out that fire and that enthusiasm in people to come up with those ideas for the future, because we certainly don't have all those ideas. And I think if you can think about the tone of your conversations so you invigorate the excitement about what's possible, not the threat about what's being taken away, there's something about that golden thread in that for me.
Sam, can I check? Any more questions? Did anybody have? I can probably squeeze one. No, Dan's shaking his hand at me and saying no, but I reckon I could get one, and if anyone had a burning one, Claire. I promise, Dan.
And I'll be quick, Dan, sorry. So I'm Claire Morris, the Chief Executive of Rethink Partners. I'm just like drawing those threads together. We've talked a lot about why, what, how, why really important, but I don't think enough in and of itself, but it is really important. The what, 10-year plan, policy, yada, yada, yada. Yeah. Same old, like it's what we've been trying to do for decades. I'm with Helen, I've been at this for a while. We talked a lot about the how this morning, and your question was about that. I've asked at several national conferences around digital care what the national model for digital transformation is. And they honestly, to senior leaders, they didn't actually understand the question. Like, because the technology is there, they didn't understand the question, and maybe that is wrong. But for me, that question is, digital transformation is about the how. How do we make this change happen? And in addition to that, how do we get more people who get the how? Because we spend so much time talking to people about the what. But we need an army of change agents, in your teams. And what is our method? What do we want to teach them in? So, sorry, my question is like, how do we get more people knowing the how? Because it's exhausting for Lisa to be the only person in her system who gets the how. She's not the only person. But how do we get more of the how?
More of the how. Helen whispered in my ear that we have a plant in the audience, Kate, who I might just, like, a response to that from Claire, perhaps? If we could scoot a mic over to Claire. Kate is the Chief Transformation Digital Officer at the Brandon Trust. might be able to help answer some of that for you, Claire.
Yeah, thank you. It's a conversation we're having at the moment at the Brandon Trust and thinking about our digital strategy in the loosest sense. But there's an element for us around, there is no reference architecture for social care. There is no ontology and taxonomy around, whereas in the health service we have that really sort of mature environment. So, for example, when we're thinking about sensor-based technologies, you know, we've got some very point-based solutions that are kind of care, tech-enabled care, point-based solutions. They don't integrate with anything. They don't, the data is really inaccessible. We've got the same with health that's got really high thresholds for clinical care, for clinical results, really expensive, really hard to integrate, really difficult to get over those barriers. And then we've got, as you mentioned, Mike, the world of consumer tech that we can buy off the shelf and is really simple. But actually connecting that with health and social technology is a complete nightmare. So one of the things I would call for is, you know, as a sector, is how do we start to have conversations where we create that reference architecture that starts to say, this is the type of environment we want, and then we can build that into our data warehouses, and then we can layer over the magic AI and the LLMs to start to build actually predictive and, you know, preventative work around it. But we can't do that work until we've actually done that hard work, and I think that's the bit that we're not really talking about yet.
Fabulous, thank you. I know that I'm just over on time, but can I ask our panellists just to give one moment of reflection, maybe in relation to Claire's question there, and then we'll close, and Dan hopefully won't kill me. Maybe Helen?
At the risk of being simplistic about something that is a very complex issue, I think even just following from Kate's contribution, I'm always impressed by the resource and the talent that we have in health and social care. So I think we need to do some sort of resource mining so that we really allow people to flourish who can be part of the thinking, the ideas, the solutions we need. That would include people with lived experience, but we've got phenomenal expertise in this room and beyond, so let's really mine that talent.
Lisa?
Great, something to build on. So networks for me, and building and amplifying those stories of change that have had impact. You know, there are many places in the country trying this stuff, but trying at different paces and with different starting points. We've been very intentional that we're starting it on a place-based footprint, health and care from the beginning. We're not tripping over each other. We're doing it with that humility of saying we're in it together. But we've got to learn and spread that learning, and that set of principles that then might come out of that for me, Claire, are then part of the how, but then adapting that to places and pivoting back up and down again. So it's not a blueprint thing for me. It's spreading and thinking about what are the ingredients in the principles that could become some of those guiding lights. And the enablers like the data and the things like that. And let's not forget family carers in this. You know, we're not talking about just families who, you know, are just one-dimensional. There's a ripple effect of this stuff. So let's hear the stories from those that are touched by this stuff, and then amplify those to help us get those principles and back down and up into the systems that we're working in.
Thank you.
I think to your point, Claire, in the absence of some of the overarching guidance or legislation that we might want to enable us to do things in a clear and structured way collectively, I think the onus on all of us is to be really creative in how we consider what our solutions will be in a safe way. But to your point, Mike, so for example, giving somebody an Amazon show, my service gives out hundreds of those. We give out hundreds of Ring doorbells. People might think that feels really frivolous because, of course, you could just go and buy that. But we can quite clearly and easily align that supporting people to have a much better quality of life and outcome from either a health or care perspective. So we just need to start to think creatively, take more positive risks, and be much more open-minded while we don't have the support that we might all wish that we get.
Yeah, I agree with everything that's been said so far, but it is a massive challenge. I guess the only other thing to add, I would say, is actually trust social care itself. Actually look at how you enable the money to go down directly. Really good example was it's been great to see the investment in care planning systems, digital care planning systems. So that is a big step forward from the NHS supporting social care, brilliant. But actually it probably would have been better had you just given the money directly to social care providers and enable them to get a better deal. What we've seen, because the money went through the NHS, and this isn't their fault in any shape or form, but ultimately, we as providers have now had a 9% increase in our costs, a second 9% in our costs, and they've just come forward to propose another 7%. That's just the provider I'm using as a really good example. And that's because they know that the NHS tied providers into certain periods, certain conditions, and they could do whatever they wanted in that period of time. So I just think we need to look at smarter and trusting one another, which comes back to so much that's been said on the panel about relationships. Thanks.
Fantastic. And I just want to say a huge thank you to all of our panellists. We could have kept going for the whole event and you'd have loved it, but unfortunately we can't. So thank you in the usual way. Big round of applause. Thank you.
Do you want to announce the next one?
Apparently,